I want to welcome everybody to our webinar titled Everything You Need to Know About Knee Pain. It's hosted by Santeen Chiropractic and presented by myself, Dr. Angelo Santeen. Now, the reason why I'm hosting this webinar is because over the last 10 years in practice, I've seen people really struggle with knee pain. Even worse, it seems to limit their lifestyle. They have to give up the things that they love to do. And I want to change that for the people in my practice and for the people in my community. Speaking of change, I want to start off this webinar by sharing a story of a patient of mine named Jason. Now, Jason presented with back and knee pain. He had an old football injury to the knee that bothered him nearly every day. And to compound that, he was also a mechanic, so he was on his feet the whole day. Now imagine how he felt by the end of the day. Yeah, he was wiped out and fatigued. His symptoms were preventing him from exercising and being active with his children. So he started chiropractic care with us right away, but we also added our rehab protocol, the things that we're going to go through with you today. Once he implemented that, he was pain-free in 6 months and doing whatever he wanted to do. Now, what impact do you think that made on his energy levels and, frankly, his whole life? So my name is Dr. Angelo Santeen, and how the body heals is a specialty of mine. I've been working with patients for 10 years and have observed thousands of people come into my office that were initially struggling with their health, and I was fortunate to see the majority of those people get well. My rigorous schooling combined with this experience allowed me to really master my ability to assist people in getting better. Over the course of the webinar, we're going to learn, number one, how the knee works, because I believe if you're educated, you're going to make better decisions for yourself. Number two, an action plan you can implement to start the healing process. And lastly, who to go for help if this action plan fails. I want you to come away with one or two things that are going to make a big deal to your health. Lastly, if you have any questions or concerns, do not hesitate to email us at santeenchiropractic@gmail.com. And I'll do my best to answer those personally as soon as possible. But before we get to the knee, I quickly want to review the basics and the understanding of health. Now, when I say the word health, what do you think of? What does it mean to you? Do you believe, like on the left, that health is an outside-in process in which medicines, drugs, and surgery help us get better? Or do you believe that health is an inside-out process where the body inherently and innately has the potential to heal itself, barring there's no major interference? Let me give an example. If you were to cut your finger, you're going to put some peroxide, a Band-Aid. Sometimes you might even need a stitch if it's really bad, but the finger will heal. Now go to the butcher and get a nice piece of steak. Put a cut in it, put some peroxide, even put a stitch on it and bandage it. Is the steak going to heal? Well, no, that's ridiculous. We need the living body to do the healing. Your body, including your knee, was programmed to heal itself, barring there isn't major interference. So let's explore the ways that we can remove that interference to allow our bodies and knees to heal up. Let's begin by looking at the knee up close so we can understand the basics, so we can make better decisions about the healing process. In order to understand where the pain is coming from, we should know the basic anatomy of the knee. Let's look at the bones first. This diagram is looking at a right knee from the front. This top bone is a thigh bone called the femur. The bottom bone, or the shin bone, is called the tibia. The kneecap, what we call the patella, floats on top and acts as a pivot for the quadriceps to travel over and pull up on the shin bone, therefore extending the leg. Supporting these bones are ligaments. We have our inside ligament called the medial collateral ligament, or MCL. Outside ligament, LCL, or lateral collateral ligament, and the cruciate ligaments, your anterior cruciate, or ACL, and your posterior cruciate, or your PCL. These ligaments offer a degree of stability to the joint. Then we have the cartilage that gives the knee cushioning, which is called the meniscus. Now you look to the left of the diagram, you can see you have a lot of muscles and tendons crossing the joint. They also offer stability. Now the quadricep is one of the largest muscles in the body, and it turns into the patellar tendon, which can be a major source of the problem. So the area of pain gives us a clue where the problem is coming from. Now, is your pain superficial over a tendon or muscle? Then that would lead us to believe it's more of a tendonitis, or a strain or sprain, or bursitis. Or is it deep in the joint, sharp in nature, indicating possibly a cartilage tear or cartilage problem? Is it dull in nature with stiffness, which gets better with movement and activity? This would lead us to believe it's an arthritic problem. Is it in the front, back, inside, out? Location of pain is really important in giving us an idea of where to begin to fix the problem. Let's take a look how the knee gets injured, or discuss it a little bit further. Most people think this has to happen with trauma, whether it be major or minor. Now, for the purpose of this webinar, we're going to assume that there's no major trauma, where structures could be torn or worse, fractured, in which you need emergency medical attention. We're going to talk about minor traumas, bumps and bruises and twists. That can definitely damage the knee joint. Overuse can also damage the knee joint. We just don't give the knee the rest it needs to recover, whether that be from work or from sports. Could it be lack of strength? Absolutely. We sit far too much at our workstations, creating weakness in glutes and quads, which are necessary to stabilize the knee joint. And by the way, this also applies to the hips and lower back as well. So it's something to think about. Is it from lack of flexibility? Yeah, tight muscles can pull on joints or cause the joints not to flex or extend properly. And is it a normal part of aging? Arthritis. Do I have to put up with it? Some of you might think. And although this might be partially true, look at it from this way. If we were meant to break down with age, why doesn't every joint just follow suit? So I believe it's usually a combination. This is what I see most often. There's usually a combination of trauma, some overuse, lack of strength, lack of flexibility, and aging, which all contribute to the problem. Therefore, we should design a plan to tackle all of these areas when trying to get the knee better. So you can see things get complicated right away, and it can make getting answers often be overwhelming. Is it a meniscus injury, tendonitis, bursitis, ligament tear, patellar problem, arthritis, inflammation? Answers can be hard to get. And you probably have tried things at this point. Rest, ice, gels and creams. Is that getting down to the root of the problem? Exercise can often aggravate the knee. Drugs can be dangerous. Sometimes therapy may not be right. And surgery is not always the answer. In fact, they found a study done in 2013 in the New England Journal of Medicine found that whether the patients had arthroscopic knee surgery or not, they had the same outcome. In my opinion, we need to widen our search. Remember the nursery rhyme from our younger days? Think about it. The knee sits between the foot and the pelvis, and it can be heavily influenced by both. We should be looking at the function of both these areas to see if there's potential trouble areas in those sections. So let's look at the foot. Now what we are looking for is something called excessive pronation, or turning in of the foot. Focusing on the picture on the left, we're looking at the right foot from behind. With overpronation, we see the foot collapse inward, creating an angle at the Achilles tendon when we look at it from behind. Moving to the picture on the right, we can see what this pronation does to the rest of the body. As the foot turns in, it forces the shin bone, or the tibia, to rotate inward. This can cause grinding in the knee, specifically on the inside part, and excessive extension of the knee. The thigh bone, or the femur, also turns inward, causing potential hip pain. A drop in the pelvis as well happens, and even back pain over time. Now, I know these can be small problems, but imagine taking 10,000 steps or more per day over 300 days, over 10 years, and you can see how small things start to become big. Now, moving to above the knee, we need to keep our focus and look for leg length inequality, specifically looking to see if there's an imbalance from one side to the other. Now, with leg length inequality, you'll see a significant drop in height on one side, causing increased pressure at the hip and knee joint on the same side. On the right-hand side, this is an x-ray from a patient of mine who had low back and knee complaint, where his left pelvis was over 2 centimeters short compared to the right. Finally, we cannot forget to look at the spine. As you can see from the picture on the left, the nervous system controls everything, including the function and power of the leg muscles. Nerves to the legs exit the lower back, and good supply is necessary for good leg function. Now, unfortunately, low back pain affects upward of 80% of the people in the world. And when this happens, you can often find misaligned vertebra and pinched nerves. Now, in chiropractic, we call this vertebral subluxation, seen on the diagram on the right. When this happens, the nerves to the legs can be affected, often causing loss of power that isn't always detectable to the person themselves. Loss of power to the leg muscle can cause a potential lack of stability to the knee joint itself. So I propose then, for people who are struggling with knee pain, that they follow a specific protocol that I have observed that has worked well over the years. Now, firstly, we're going to go over and cover what you can do yourself. And secondly, if by chance your own program won't work, some tests you can do that help you lead yourself in the right direction. And lastly, where to look for professional help. Now, things that you can do. Number one, you need to apply the PRICE protocol. That's an acronym, and it stands for Protect, Rest, Ice, Compress, and Elevate. This can be used for any injury, including the knee. The idea here is to stop the damage and to control the inflammation and swelling right away. Then we're going to avoid high impact activities, strengthen the knee, address the soft tissues with a foam roll, reintroduce low impact activity, and reintroduce regular activity. Let's take a look at them in a little bit more detail. Now, we talked about PRICE already. We don't have to go through that. So after you've protected and controlled the inflammation, we're going to look at avoiding high impact to the knee. Now, for sometimes people who are really struggling, this might mean even having to stop to walk. For others, this often means stopping things like running, court sports, bike riding with an improperly fitted bike, and improperly performed exercises. Things like squats, lunges, leg press, knee extension exercises can often be doing damage. And the reason for this, it has a lot to do with knee angle. Let's take a little closer look at this, because this can make the difference between getting better or continuing to cause damage. On the picture on the far left, this lady is bending slightly at the knee, creating a large angle between the hamstring and the calf, versus the picture on the far right, where she bending deeply, her knee is bending really deeply, creating a small angle. Now, why is this so important? Because it increases the load on the knee joints. This is a study done in 2009 where they measured the force going through the knee joints as percentage of body weight. For an example, on the left, when they did a small squat with a large angle, so a shallow knee bend with a large angle, only 90% of the body weight goes through the joints. When they performed a deeper squat, this number increased to 400 to 750% of the body weight. The bottom line is the deeper the knee bends, the more force goes through it. And even a small problem there, that's already there, can become a bigger problem. This is important when you're attempting to do your own rehab program. You need to choose the exercises that will keep you in that safe range. This brings us to our next step in the treatment protocol, in which you can right away begin to gently strengthen the knee. Now, the purpose of this webinar and this slide is not to give you a specific exercise program for your knee. There is a ton of professional help and information available out there on the internet where you can learn which exercises will work for you and how many sets and reps you should do. This slide is here to give you a general idea of how things should look right off the beginning with your program. The diagram on the left is demonstrating how to keep the knee angle in mind when performing these exercises and how low impact these need to be right off the bat. The diagram on the right shows a progression of these exercises using more of your body weight and challenging yourself a bit more. Now, my absolute favorite safe way to strengthen the knee and the quadriceps and the muscles surrounding the knee is in the bottom right-hand corner of the slide, where the person is demonstrating a wall slide. Now here you can control how low you can go and take the weight off your knees by putting your body against the wall. It's a wonderful exercise that can be done through all parts of your rehabilitation. The idea with this slide again is to start small and light and progress upwards, challenge yourself along the way. Once you've mastered the basic strengthening, the next step in your rehab protocol should be to add some advanced strengthening. Now, in my opinion, a really good personal trainer is worth their weight in gold, and they can take you through the exercise in a safe and efficient manner. Things like squats, lunges, and calf raises all work well to stabilize that knee joint. And don't forget to work on your glutes. Your glutes offer stability throughout the whole body, your back, hips, and yes, your knees. While you're starting your activity back up, it's important not to forget to focus on the soft tissue surrounding the knee. Foam rolling is an excellent way to address this, as it 1, breaks up scar tissue, 2, loosens muscles, 3, improves blood flow, 4, improves flexibility, and 5, it's inexpensive. Again, there's tons of information and videos you can find to help you out with the specifics around this area. Now it's time to start reintroducing low-impact activity. Things like walking, yoga, swimming, tai chi, and yes, biking. Biking. If you're gonna go into a bike, you want to make sure that you're properly fit. If the seat is too low, it can create a small knee angle, which, as we know, can create too much pressure on the joint and thus damage. Make sure the seat is high enough and still safe and comfortable to ride. Biking can strengthen the knee, and the repetitive bending seems to lubricate the knee and help, especially with people with knee arthritis. You can get places with it, to work or to school. It's exercise for your cardiovascular system, and it's fun. You're outside and you're getting fresh air. Now, if you're doing all those things well and you have no knee pain, you're ready to reintroduce regular activity. But remember to do so gradually, both in frequency and intensity, keeping an eye out on how you're feeling overall. Just to review the steps in the protocol one more time in order, you want to start with the PRICE protocol. Protect, rest, ice, compress, and elevate. You want to avoid impact, add basic and advanced strengthening, address the soft tissue with the foam rolling, I love it, reintroduce low impact activity, followed by reintroducing your high impact activity. But what if you still have pain? Now, don't feel discouraged, because this happens often. What we're going to do is take a look at some of the self-tests you can do in order to help you steer yourself in the right direction as far as pursuing professional help. You may need a partner for some of these tests. And this first test, we're going to be looking for overpronation. On the left, you'll see again, this is a picture of a foot from behind. Get your partner to look at your foot and your Achilles tendon. What they're looking for is the foot to be caving in, and for that Achilles to have a bow or an angle in it. Another way to test for pronation is to wet your foot slightly and walk on concrete or tile, or somewhere where you can see your foot imprint. Normally, you're going to see a curve in the middle of your footprint, where the arch should not be contacting the ground. If the foot arch is collapsing and you're pronating, you will see a foot pattern like that on the far right of the slide, where you see the whole foot contacting the ground. If one or both of these tests are positive, it's likely indicating that you do have excessive pronation, and then you need an examination and likely orthotics to correct that foot pronation. Now remember, as we explained before, this is going to help the alignment of the knee as well. Now, self-test for leg length inequality. You're probably going to need a partner for this. Now, the first way to look for this inequality would be to lay down on a bed face down with your feet hanging over the edge. Your partner will slightly pick up the weight of your feet and bring the heels gently together. Now, for the most part, your feet should be aligned. But like in this diagram, often you're going to find that one foot will be significantly shorter than the other. This can be a clue that you have a leg length inequality coming from the spine or pelvis. Now, a second way to do this is through general observation of your posture. It's good to have someone look at you from behind, preferably with your shirt off. Are your shoulders level? Are your shoulder blades level? Is your belt line level? Does your foot flare on one side more than the other? These are all signs that you may be suffering from a leg length inequality, which will ultimately cause hip and knee problems on that same slide. Now, signs that your spine is involved? That's simple. If you have previous or current problems with back pain, unexplained stiffness and lack of mobility in the back, dull leg pain, sciatica, cramping in the legs, weakness in the legs, or bowel and bladder troubles. So if one of these tests are positive, how do we choose the appropriate healthcare practitioner? If it's solely a foot problem, then a qualified chiropodist, podiatrist, podorthist, and yes, even a chiropractor can easily cast the feet for orthotics and prescribe custom-made orthotics for the foot problem. If it's just a knee problem and you've ruled the other two out, then your best bet is to find a great therapist or personal trainer. Now, although chiropractors are trained in rehabilitation, a good trainer or therapist is worth their weight in gold in this area. And lastly, if it's just a spine and pelvis problem, well, this is where we as chiropractors really shine. We are expert in examining the spine and pelvis to look for misalignments, and experts in applying the specific adjustment necessary to correct them. Now, before we sign off on this webinar, I want to share a couple of stories with you, a couple of cases, just to put things in perspective. Now, this is Ron. He's 63 and an avid golfer. He came into my clinic because he was having back pain. But after I dug a little bit more into his lifestyle, I realized he was having knee and hip problem as well. And golfing was really aggravating his knee, so much that he had to quit from doing it. Otherwise, his knee would swell up quite a bit. Now, this is an x-ray of his lower back and pelvis, and we're looking at him from behind. As you can notice on this slide, his right side is significantly lower than his left by over 2 centimeters. And if you look closer at that yellow arrow, you'll notice that the socket of his right hip is flattening out more than the other side, which is a sign of arthritis. Now, my conclusion was that his leg length inequality was causing his hip and knee pain, and that was confirmed because once we added the rehab protocol and his chiropractic adjustments, his symptoms resolved. And by the way, he's playing golf as much as he wants to with no knee pain whatsoever. Now, this is Glenn, who's a 52-year-old pipe fitter that presented to my clinic with low back pain, which is leg pain coming from the back, and knee pain. At the end of a long day of work, he was wiped out, and often he had to miss work due to the fact that his leg pain was so bad. We x-rayed him and we saw that the left side of the screen, that picture, his leg length inequality was over 2 centimeters. Now, because of the demands of his job, he wasn't really able to do a lot of rehab of the knee. So all that we did was adjust his spine and pelvis in order to correct this. Now, this is him after 1 year of care. His pelvis is nearly level and, more importantly, has no back, leg, or knee pain, and hasn't missed a day of work since starting his chiropractic care. Lastly, this is Mike, a 22-year-old university student who presented with mild knee pain, but really noticed extreme weakness in his workouts. When he was doing squats and lunges, he noticed his left leg would almost give out. So we x-rayed him and we saw leg length inequality of close to 18 millimeters, close to 2 centimeters on that left-hand picture. This is him 1 year after care, reduced to only 7 millimeters. And his workouts are going fine. He's functioning 100%. Now, a lot of these things I'm talking about are not just off the top of my head. There is clinical research in peer-reviewed journals to support the things that I'm talking about today. I just want to share a few studies to reinforce what I've covered to this point. Now, this was a study done on 146 military conscripts. They gave half of these people orthotics and the other half fake orthotics. And what they found was the people with orthotics had a 20% drop in injury rate in the back, lower extremity, and knee. 20% just by adding a custom-made orthotic. This study, done in the Annals of Internal Medicine, 2010, took 3,000 people and did full x-rays of the lower limb. Leg length inequality of more than 1 centimeter was associated with x-ray and symptomatic arthritis in the shorter limb. And the authors stated that these results suggest that a leg length inequality may be an important risk factor for knee osteoarthritis. And the risk they found is primarily in the shorter limb. Now, this study was done where they took one chiropractic adjustment, applied it to the pelvis, and then measured the quadriceps strength right after. And what they found was that 85% of the patients treated with one adjustment had an increase in quadriceps strength. And that strength on average was a 10% increase. And the author stated that it cannot be denied that the use of a chiropractic manipulative technique is an effective way to increase quadriceps strength. And because of this, an adjustment could be administered with a strengthening program for people with knee pain. And lastly, the study has been approved to be published in the Journal of Experimental Brain Research. This is a brand new study where they measured the brain activity from the brain through the nerves to the muscles of the leg. And they looked at this activity right after a chiropractic adjustment. And what they found was an increase of almost 60% in the electrical activity readings from specifically targeted muscles in the legs, a 16% increase in absolute force measures, and a 45% increase in the drive from the brain to the muscle. So one adjustment got their brain talking to their body 45% better and 16% more power in those leg muscles. Now, before we close this webinar, I want to leave you with a very interesting story. And this story is of a patient of mine named Ian. Ian was in his mid-30s, a fantastic athlete, semi-pro hockey player, a really good golfer, competitive rower who nearly made the Canadian national team. He's a very active, full of life type of guy. Now, in the winter of 2009, he turned the wrong way while playing hockey and suffered a knee injury. Initially, he didn't think anything of it, and really neither did I. We both thought he would just bounce back the way he always did. He backed off his activity, began the strengthening, but unfortunately, he just wasn't getting better. We both decided it was a good idea to follow up with his GP and to get the appropriate imaging that was needed. X-rays and MRI came back negative, and he was sent to see an orthopedic surgeon. Now, it was spring by this time, and he was planning to go on a huge bike tour of Europe in July with his fiancée. And the news the orthopedic surgeon gave him disappointed him. And that news was that he needed surgery. They believed that exploratory surgery was necessary to fix the knee problem. Well, Ian was upset, And I remember talking with him on his regular chiropractic adjustment appointment and remembered how disappointed he was. So Ian asked the surgeon if it could wait until after his trip. And the surgeon says, look, Ian, the longer you wait, the more damage you're going to create. And I knew this was what Ian was going to do. Ian politely and respectfully declined to have the surgery and decided to go away on his trip anyway. Him and his fiancée biked from England to Greece. And by the time he got to Greece, you know what he realized? That his knee pain was gone. His knee felt great. He got back from his trip, canceled his surgery, and the following summer participated in his first triathlon. Now I'm just amazed on how his body was able to heal himself. And I believe truly that we all have that same potential somewhere in us. You can probably gather how passionate that I am that people need to reach their full potential. You can also see by the research and the cases that I shared that at times, often, you just need the right help at the right time. Now, we all have a tendency to procrastinate with taking the next step and getting healthier. So in order to help you not to do that, we are willing to waive our initial visit fee for the next 30 days. That's the entire month of June. What that includes is a full orthopedic and neurological exam, including x-rays of the lower back, a knee exam, and a gait scan for your feet. Regular price for that workup is over $135. You'll have the workup and we'll bring you back in to share the results. Now, what you choose to do with that information is up to you. We're not going to hound you or badger you. If you want an opportunity to do that, all you have to do is email us at santinechiropractic@gmail.com and reference this webinar. And our staff will take care of the rest. I hope you received a lot of value out of this webinar, and I hope you can apply a few things that will get you back to doing the things that you love. Keep your eyes peeled for future webinars and live seminars as they will be rolling out over the summer, fall, and winter. Thank you for joining me, and until next time, discover better health.